So you should see the New York tracker epi curve still on the up and up, even if we're trying to envision that maybe the top part of that graph is beginning to curve a little, still hitting over 150,000 cases and now over 1,200 deaths. So back at a really high mark. So here's Alabama. Very sort of erratic reporting of cases. You can see that we've had peaks, which are well above 6,000 cases in a day. It's hard to know how to smooth the curve when you're getting these erratic loads or discharges of reporting of cases. Be that as it may, we're still now hitting just about where we were back in our worst days in December and January. And for the final sort of look at Alabama, these are the places on my dashboard that I'm tracking. It's amazing how these vary from day to day. Just yesterday, again, on an individual county level basis, every one of these counties was experiencing a negative change. And now among these counties, only Mobile County is experiencing a negative change. So these things really are sensitive to the large reporting inconsistencies over time.
These are the slides that we typically look at for the incident command group. And one of the things that we look at are what the trends are by district. We're looking at data in Jefferson County that's really among the highest. I know it's tough to see, but we're looking at 5,300, 5,400 cases reported today, nearly 800 in Jefferson County, which gets higher than it was, and 600 in Mobile County, which again takes it really, really high. That's after I did some smoothing on it with the cases they reported before to account for the reporting bias. So I don't think it's decreasing. It's not. We're still on a steady upward track. Jefferson County in particular is the county that is really advancing, as is the southwestern part of the state. Jefferson County is problematic because we have the most people. And so far, all of the hospitalizations that we've had to date have been in southern Alabama, particularly in Mobile. And for those of you that don't know, there are 2 pop-up facilities that the governor signed into action that it was okay to have these mobile clinics in Mobile County. The Mobile Infirmary is really struggling right now with the number of COVID positive individuals they have in-house. And both Baldwin and Mobile County have had to set up temporary morgues. They're processing more dead bodies than they're capable of processing. So, I mean, this is real and it's problematic. And we're not even close to probably where it's going to net out unless we see some massive behavior changes. We're currently at about 2,800 hospitalizations. The peak was about 3,100 back in January. And it's estimated right now, I'm just only showing one potential model. If you've seen these before, you know that I've had 3. One that assumed Alabama would be on India's track, one on the UK's track, and one that everybody would follow Southern Alabama's track. This is really in between that Southern Alabama and India, but it's based on the data that's actually coming in statewide. So I think this one's probably fairly close to what may happen. And it looks at a peak of about 5,000 hospitalizations sometime in mid-September. That said, that doesn't have to happen. A mask mandate would reduce this by about 30% conservatively, could reduce it by more. But in the least adherent situations, which are K-12 schools, CDC has reported about a 30% reduction in cases with just having a mandate, not with having people wear the mask, not with making sure they're wearing it properly, but just having a mandate in place, reduced COVID cases in schools that had a mask mandate versus those that didn't. If people wear it correctly, that percentage goes down to, or goes up to closer to 75 or 80% reduction in cases. But I think that 30% would be fantastic. I don't think we have to have 75 or 80% to avoid that 5,000 hospitalization peak. A massive vaccine campaign would matter too. If we could get 70% vaccinated This should further reduce hospitalizations, not necessarily at the peak, but it will reduce the duration that those hospitals have to work at that very high peak. So the vaccine and the mask together really will make a huge difference. To show folks where we are in relation to the folks around us, because that's important, these external pressures that we'll get. First of all, CDC stopped reporting daily cases. They now look at weekly cases. So it's kind of a shifting of your brain. They used to report cases per 100,000 per day, but now it's cases per 100,000 per week. So in Jefferson County, we're probably actually a little bit higher than 585 at the moment. This was on Wednesday when I pulled this, and in Alabama at about 581. If we compare that to our neighbors, which is really important when we think about trends, Florida is still much higher than us, as is Louisiana and Mississippi, and those will all put external pressure on the state to continue to drive up cases. Georgia and Tennessee are starting to respond. They used to be much lower than Alabama, but you'll see their numbers getting really close to our numbers, which means that we'll get pressure even more from around us. So if you look all around us, the outlook is still not, we haven't turned the corner at all. To me, the scariest data, and I'm waiting one more week before we know for sure what's happening, because something goofy happened with the data this week where all age groups flattened except 0 to 17-year-olds, which tells me there's probably something funny going on with the data, and I wouldn't put 100% stock in this until I get the new cut next week. But this is the first time, if this is real and the trend holds next week, this is the first time in the entire pandemic that there have been more cases in 0 to 17-year-olds than other age groups. This is the slide that shows the entire pandemic there, this solid yellow line. They're always well below all other age groups, and they've really spiked up in the last week. And there's a lot of students that are back in school, so it's not that this should be surprising. But again, if this trend holds, about 2 weeks from now, those cases are going to show up in 20, 30, 40-year-olds that are their parents and caregivers. So really, we're not in a great spot yet. We still have several weeks that we have to be prepared for very high caseload.